welcome back to Good Morning Sri Lanka. It's final segment of this morning's show, and yes, I'm Wassam with Dr. Salia Pathirana talking to us about a disease that can be very, 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 very serious to people, and that's glaucoma. And of course, during the last segment, we're talking about what glaucoma is, and right now we're just gonna go into what people think about glaucoma. Like, doctor, what are the myths? What are those things that, I mean, like every disease has its myths, right? Like people think about something, like, you know, that, but it's actually not true. So what are the myths of which people have of glaucoma?
Yeah, the main thing is, like, sometimes, you know, whenever they get a headache, they think they have glaucoma.
Wow.
So I told you that, you know, at the age of 40, 50, they think headache, and they think immediately must go and get the eye pressure check. Because this eye pressure, also now all the time people are talking about eye pressure, they think moment you get a headache, it's eye pressure.
Okay.
But of course I had to tell you that open angle glaucoma, this common glaucoma, they don't get a headache. That's why originally I said that there's no symptoms at all.
Okay.
They don't get symptoms, there's no headache. Unless they have this angle closure type, which is not that common. So the other thing is, they think now moment I say that, you know, you have a condition called glaucoma, they said, oh my God, I used to read a lot. I used to watch TV and all sorts of things. I mean, they think that reading a lot, or, you know, watching TV
or being
and
in front of the
using
computer for a long time.
computer long time will develop glaucoma. Of course, these are all myths, and you don't get glaucoma by reading books or watching TV or using laptops or the computers. Then they think certain type of food, I mean, I ate such and such food, or some bad food or good food. I mean, there's no relationship at all to any of these foods. Food items or your day-to-day habits, nothing, these things are not related to glaucoma.
I see. So then what is related to glaucoma?
The number one is that hereditary factor I told you. As if you have a blood relation, you have a high risk of getting open angle glaucoma.
Okay.
Other than that, of course, the cause is unknown. We actually don't know how this.
So it's not really figured out?
Not really 100%. We don't know how the, in open angle type, we don't know how this restriction of drainage comes in. We really don't know. We only know that there is some restriction to the drainage of this fluid which is formed in the eye, and the pressure gradually starts rising.
I mean, usually when you say pressure and stuff, doctor, people associate it with stress as well. Is there a relation there?
There is no relationship at all, and there is no relationship to blood pressure also. People think if I have blood pressure, then I'm going to get eye pressure.
Okay.
There is no relationship.
I see.
So finally, the problem is that the drainage angle in the eye gradually gets, you know, obstructed due to some reason, and the production of fluid and out of the outflow of fluid, there is some imbalance. So input is there, but the output is less. So the pressure starts building up, and that pressure acts on the optic nerve and damages the nerve fibers, and that's the one leads to finally gradual loss of vision.
I see. So how does one, when someone's diagnosed, before going into diagnosis, doctor, how does one prevent something like this?
Yes, there is no way you can prevent it. If a hater is going to get it, just only way is that you must get your eye pressure checked at the age of 40, especially after 40 gradually. Say, if you don't have blood relation, but still better at least every 2 years get a good eye pressure.
Okay, I'm going to stop you there for a minute, doctor. Now you keep saying over 40.
Yeah.
So does this mean that, I mean, in your 30s you have no chance of getting it?
Yeah. If you have blood relations, better start early.
Okay.
That is even in 30s. You never know. Some people can have it, then sometimes really 20s also.
Wow.
So if you have a blood relation, better to get it checked early as possible.
I see.
But of course, if you don't have blood relations after the age of 40, it's common.
When you say blood relation, you mean about hereditary factors?
Yes, that means your father, mother, or the uncle, so some sort of the relation, close relations.
Okay, so the first way of preventing this, you said was you said you can't prevent it.
Can't prevent it by detecting it early and treating it properly and maintaining the eye pressure is the only way to go.
So what you're saying is, if early detection can help you keep your vision.
That's correct. If you don't detect it, then gradually you lose your vision, and finally when you come to the doctor, maybe you have lost about 70%, you have left with 30%.
So doctor, if you do lose your vision, can you get it back?
That's a good question. You will never get your vision back. Whatever you have lost will never come back, because nerve fibers and the heart muscle fibers are the two types of things in our body which will never regenerate.
Okay.
So if you have lost it, it's lost for permanent. So nerve fibers will never regenerate. So the dead nerve fibers will never come back. Say when you come to the doctor, say if you have lost about 30% of your nerve fibers, you are left with 70%. Our job is to maintain those 70% of nerve fibers for the rest of your life. For that, we have to start treatment and maintain the eye pressure at a level where it's not going to damage the nerve fibers any further.
So what you're saying is, with treatment you can actually, like, if you follow the treatment properly, chances are that it will not get any worse.
That's correct. At least we can control the eye pressure and try to maintain your vision for the rest of your life. But I have to tell you that sometimes with the best of the drops and the treatment, certain amount of loss will come anyway. Certain amount of nerve fibers will still get damaged.
Okay.
So at that time, at the end of the thing, so if now how we are going to assess it, this now we start on treatment with drops. So let's start with one drop, and we keep doing this test regularly to see whether you are losing any further. So now the visual field is getting lost. Those electronic tests I told you will show us whether the nerve fibers are getting damaged. So in spite of our first drug, if we can see that this is damaging, then we introduce another drug, 2 drugs.
I see.
So we can go on adding up to about 3 drugs. There are various types of good modern drugs now. So all these drops will help you to keep the eye pressure down, and that will help you to prevent any damage to the optic nerve.
And
but finally, if these drops are not helping, and we see, okay, over the years, 2, 3, 4, 5 years, we find that still gradually it's losing, then we can go into surgery to reduce the pressure some more.
I see. So is that all when it comes to treatment, or is there more to it? Is that all when it comes to treatment in terms of managing it once it's detected, or is there more to it? Like for example, like apart from drops and medicine and surgery, is there anything else that you need to incorporate with maybe perhaps managing your lifestyle?
No, that's the thing. Lots of people think they should stop reading, or they should reduce their, the time of watching TV. None of this is going to help. They think I have to stop using the computer or something. None of this is going to help. Only the drops. Follow the regular clinics. Listen to your doctor, and to be very punctual about your drops, the correct time, and then go for your clinics regularly.
And how often do people need to visit clinics and the doctors?
At the beginning, now say when you detected that you have glaucoma, probably we have to see the patient very often, like say every month or every 2 months. Then gradually, when we realize that it's under control, then we ask the patient to come about say 4 months, or later about every 6 months sometimes.
I see.
So we can gradually increase the period, depending on the control. But if you find that now suddenly we find one fine day the control is not enough, then we'll increase the drops and ask them to come earlier than 6 months.
I see.
So every month or so. But then finally doctor adjusts the time and the number of clinic visits.
I see. And once you are prescribed once you are diagnosed rather with glaucoma, what kind of lifestyle changes does one need to make?
There is no lifestyle change. You can go on with your normal lifestyle. There is no restrictions at all, but only thing to follow the instructions and put the drops at the correct time. And remember that you can never stop the drops for lifetime. Once you are labeled as having glaucoma, that means you are not going to get cured. So the rest of your life you are a glaucoma patient, and these drops have to be put daily with medical doctor's instruction. And you can't say one fine day, you might say, okay, I feel good now, I don't have any problems, I have no eye pain, I have no tearing, so what's the point of putting drops? And if you stop your drops and then you start losing your vision gradually, which you will never realize till you come to the end.
I see.
So the main thing is that follow the doctor's instructions, never stop the drops without asking the doctor, or without medical advice. Don't stop your drops, and you have to use your drops for lifetime.
I see. In a hypothetical situation, doctor, for example, now if you said that sadly that there are not many symptoms until the last moment, so a person doesn't know until the very end that that person has glaucoma. And you also said that chances are that a lot of this happens when you're over 40. Now say hypothetically there's an individual who potentially have glaucoma when he was over 40. But if he does a checkup, if he goes and does a checkup way ahead of his time, say when he's in his 20s, for example, are the doctors able to detect it?
No, unless you have some amount of rise of pressure, like say eye pressure has to go up, or we should be able to look at the optic nerve or as I said, look at the angle and see whether this angle is getting closed, or whether the optic nerve has certain amount of damage. When we do the visual fields and when we do the electronic tests, we can see certain amount of changes. Now without those changes, we can't say that whether the patient is going to get glaucoma. Say a person, say as you say, somebody is above 40 who is going to get glaucoma, I check him at age of 25. Now your question is whether I can tell this man is going to get glaucoma at the age of 45. It's not possible. Unless you have certain amount of damage, certain amount of changes in the visual fields or the optic nerve or the eye pressure, we won't be able to tell. But of course, angle closure type, as I told you that the second type, the angle closure type, narrow angle type, probably even at the age of 25, when I look at the angle, I might be able to say this person is having a narrow angle, is going to get a sudden rise of eye pressure one fine day, and we can treat it and prevent it happening by doing the laser. We can make a small channel with laser to prevent him getting this angle closure during his lifetime.
I see.
So that is very important. That laser puncture, that laser drainage channel will stop you getting this angle closure for the rest of your life, guaranteed. But if you don't do it, one fine day you can get it.
I see.
And that is one condition we can detect very early and prevent it getting.
Great. Well, thank you very much, Doctor, for being with us. Unfortunately, we've come to the end of the show. But before we do close, if you could quickly, in a few words, if you could give some advice to our viewers out there, what would it be?
Yes. Remember, if you have a blood relation who has glaucoma, get your eye pressure checked. Even 30s or 40s, but regularly. But even if you don't have any blood relation, get your eye pressure checked after the age of 40, at least every 2 years or so. And if you are detected having glaucoma, please listen to the doctor's advice. Never stop your drops. You have to use your drops lifetime, and you have to do your regular visits to the clinic if you want to preserve your vision.
Great. Well, that's some great advice there by Dr. Salia Pathirana, consultant eye surgeon, who's here with us this morning to basically talk to us about a very serious topic, and I'm sure you've got a lot of insight just as much as I did. So thank you very much, Doctor, for being with us on the show. It was great having you here. I wish that you have a great weekend ahead, and to our viewers as well, if you are going for the big matches, enjoy, have a great weekend. We'll see you again next week.